Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Change in chemotherapy regimen can reduce long-term health impacts in Hodgkin's lymphoma patients. A simple change to the chemotherapy regimen for people with Hodgkin's lymphoma could reduce the long-term health impacts that can result from treatment, according to researchers in Cambridge. The findings could lead to the national guidance on chemotherapy treatments for these patients being revised. The study, published in the Lancet Oncology, compares the lasting effects of two chemotherapy regimens used to treat Hodgkin's lymphoma in younger adults. Data previously collected from 1945 patients treated with the existing chemotherapy regimen, that is EBEA-COPP, was compared to 312 patients treated with a similar regimen called EBEA-COPD-AC. Both treatments used combinations of drugs, and the change replaces one of these, procarbazine, with another called dacarbazine. Both chemotherapies achieved the same success in treating cancer, but comparison of data from the two groups showed that patients treated with EBEA-COPD-AC generally experienced fewer, less severe side effects. Exposure to air pollution contributes to millions of deaths in India, Lancet study finds. A new study from Karolinska Institute shows that long-term exposure to air pollution contributes to millions of deaths in India. The research, published in the Lancet Planetary Health, emphasizes the need for stricter air quality regulations in the country. Air pollution, consisting of particles smaller than 2.5 micrometers in diameter, PM2.5, can enter the lungs and bloodstream and is a major health risk in India. Researchers have now examined the link between these particles and mortality over a 10-year period. The study is based on data from 655 districts in India between 2009 and 2019. Poor dietary choices may increase risk of colorectal cancer. Colorectal cancer may be fueled by the food on our plates. Researchers at the University of South Florida and Tampa General Hospital Cancer Institute has uncovered a potential link between the Western diet, dominated by ultra-processed foods and unhealthy oils, and the chronic inflammation that drives tumor growth. The researchers have already made major advancements in the understanding of colorectal cancer. The project's first study examines how processed foods are likely hindering the body's natural healing processes. Their findings were published in Gut. Can good quality breakfast reduce cardiovascular risk? Having a quality breakfast that provides the right amount of energy to face the day, around a quarter of daily intake, reduces the risk of cardiovascular disease. This is highlighted by a study conducted by the hospital Del Mar Research Institute and published in the Journal of Nutrition, Health and Aging. The study followed the progress of 383 participants in the Pre-Diet Plus project, a randomized clinical trial comparing the effects of a Mediterranean diet combined with physical activity versus dietary recommendations alone on cardiovascular disease. This new work considered two factors. First, the energy intake from breakfast relative to the total daily intake, distinguishing between an adequate calorie intake and other levels. Second, the researchers analyzed the effects of consuming a high-quality breakfast with a proper balance of proteins, fats, fiber, and other nutrients. They found that consuming an adequate amount of energy in the morning and doing so with high-quality food contributed to reducing cardiovascular risk factors. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.